All right, let's get into it. What if you could solve a healthcare problem, not by rushing to the ER or waiting weeks for an appointment, but with a simple text message from your own couch? Today, we're going to look at a totally new model that's trying to do just that. And it all starts with what's so broken about the system we have now. And this really gets to the heart of the problem. A recent Gallup poll found that a staggering 73% of Americans feel like our healthcare system is failing them. I mean, think about that. That's nearly 3 out of every 4 people. It's actually the lowest rating the U.S. healthcare system has gotten in over 2 decades. So, what's really going on here?
Well, when you ask people what's driving all that frustration, it really comes down to 3 big things. Number 1, by a long shot, is cost. For 61% of people, it's just not affordable. Then you've got 40% who feel the whole system is just way too focused on profits. And finally, almost a third of people are just completely overwhelmed by how complex it all is. You practically need a PhD just to figure out your own insurance plan.
But, these aren't just numbers on a chart. This is a real gap in care that affects all of us every single day. For 20 years, an ER physician named Dr. Dirk saw this reality firsthand. He saw emergency rooms just totally swamped, urgent care centers with waits that were hours long, and he saw people getting sicker just because getting help felt impossible. And all that experience led to a really simple, almost obvious idea. See, for years, Dr. Dirk's friends and family, they had a kind of a secret weapon. It was him. Whenever they had a weird rash or a sore throat or a UTI, they didn't go online to book an appointment. Nope. They just texted their doctor in the family. A couple of messages, maybe send a picture, and boom, problem solved.
And that little informal system led to the big aha moment. During the pandemic, a city leader he was working with just casually asked him this question. And that's when it all clicked. What if you could take that doctor and the family experience and actually offer it to an entire city? What if everyone had that direct line for help?
Okay, so how do you actually take that super simple idea and turn it into a real service that anyone can use? Well, the solution is, honestly, just as simple as the idea itself. It all boils down to just 3 easy steps. So here's how it plays out. Let's say your kid wakes up with a really nasty sore throat. Instead of that frantic scramble to find an appointment, you just pull out your phone and text a dedicated number. In about 2 minutes, you're connected with a real medical provider. You can text back and forth, maybe snap a picture of your kid's throat, and get a diagnosis and a prescription sent right to your pharmacy, all without ever leaving your house. And we're not just talking about 1 or 2 minor things here. The scope of what this covers is huge. It's all those common, urgent things, colds, the flu, UTIs, sinus infections, weird rashes. But it's also things like medication questions, mental health guidance, and even advice on wellness. It turns out, for about 97%